our topic of discussion is systemic anti-cancer therapy. So today we will talk about cytotoxic chemotherapy, targeted therapy, hormone therapy, and immunotherapy. So what is difference between these different types of therapy? So chemotherapy, this targets proliferating cells. So proliferating cells, obviously cancer cell is proliferating cells, so it targets cancer cells. But you know that the epithelial cells in GI tract, those are also proliferating. So it also damages those cells. It also damages skin cells. It also damages bone marrow cells. So you can see a lot of side effect with cytotoxic chemotherapy because it also targets normally proliferating cells. But what is the difference between chemotherapy and targeted therapy? It targets cancer cells. So the genes, proteins present in cancer cells. That's why these systemic side effects does not occur in targeted therapy. And hormone therapy, you might have heard about estrogen, progesterone. So this estrogen, progesterone cause proliferation of the breast cancer cells. So when you inhibit these receptor of estrogen receptor, progesterone receptor, then that also hurts the growth of cancer cells. And the last is immunotherapy. So to understand immunotherapy, you have to understand the tumor immunology. So let's suppose this is one of the tumor cells, this is the nucleus of tumor cell, and this is the DNA inside tumor cell. So tumor cell is abnormal cell in your body. So if there is any abnormal cell, immune system tries to eliminate it. So T cell comes to eliminate these tumor cells. So it recognizes the antigen on the tumor cells through its receptor. So for it to kill the tumor cell, it should get activated. But this tumor cell has one trick. It expresses PD-L1 ligand. So when there is engagement of the PD with PD ligand, what happens is this T cell becomes inhibited. So this T cell cannot kill the tumor cell. Similarly, T cell has CTLAR4 called cytotoxic lymphocyte associated antigen. When it interacts with the receptor on the tumor cell, it becomes inhibited, and thus it cannot kill tumor cell. So to activate the T cell, what you have to do? You have to inhibit these immune checkpoint inhibitors. So there are a variety of molecules like pembrolizumab, nivolumab, ipilimumab that inhibits this interaction. So when this interaction is inhibited, what occurs? This inhibition is halted, and this T cell is activated, and this will kill the tumor cell. That is immunotherapy. So activating the immune system to kill cancer cell. You might have heard about cellular immunotherapy. It is also called adoptive T cell transfer therapy. I told you that when there is a tumor cell, then T cell comes to attack that tumor cell, to destroy that tumor cell. So in cellular immunotherapy, what they do that they extract the T cell from the patient and they engineer it. They do genetic engineering of the T cell. Genetic engineering of T cell, and they reinfuse in the patient, and that genetically engineered T cell will now attack these cancer cells. That is called cellular immunotherapy. You might have heard about CAR T cell therapy, which is used in hematological malignancy, and it is becoming popular in other cancers as well. They do genetic modification of this T cell. So what are the various molecules used in immunotherapy? Pembrolizumab, nivolumab. These targets PD ligand interaction. Ipilimumab, this targets CTLAR. Ipilimumab, this targets CTLAR interaction. And this immunotherapy is widely used in variety of cancers. You might have heard that in metastatic melanoma, this has increased the survival from 6 months to 5 years. 5-year survival has largely increased with immunotherapy. Similarly, it is used in variety of other cancers like head and neck cancer, renal carcinoma, urothelial cancers. Now let's talk about targeted therapy. Targeted therapy. So I told you that it targets certain genes, proteins in cancer cells. So this is a cell, this is the nucleus, and this is the protein. For a normal cell to become cancer cell, what steps occur? One is there is genomic instability. Second, evasion of apoptosis. Three is evasion of growth suppressor. Fourth is stimulation with growth signaling molecules. Fifth is evasion of immune system, because immune system tries to eliminate the cancer cell. So evasion of immune system. Sixth is angiogenesis and invasion. So you see there are variety of steps that promotes this growth of cancer cells. So you can target this step with PARP inhibitors. You can target this step with BCL-T2 inhibitors. You can target this step with CDK4 inhibitors, cyclin dependent kinase inhibitors. And there are other variety of signaling molecules like EGFR, VEGFR, HER2. You can target this with the inhibitor of these molecules. Similarly, evasion of immune system, I told you about immunotherapy. So here you can use immunotherapy. Angiogenesis and invasion. So angiogenesis, vascular endothelial growth factor receptor. So you can inhibit this. So you can target variety of or different steps in the cancer cell growth and invasion metastasis. That's why it is called targeted. Targeted to cancer cells and targeted to variety of steps in cancer cell growth and invasion. So some targets on the surface of the cell, some goes inside the cell and inhibits the enzymes. like EGFR receptor inhibitors, VEGFR receptor inhibitor. This inhibits on the surface, but tyrosine kinase inhibitors goes inside the cell and inhibits the tyrosine kinase. So this is about targeted therapy, and I already told you about immunotherapy. And the last is cytotoxic chemotherapy. I told you that this is non-specific to cancer cells. It targets variety of other proliferating cells. Basically, for the synthesis of new cells, there is purine pyrimidine synthesis, adenine, guanine, cytosine, thymine, uracil. These are synthesized, and these forms the DNA. DNA synthesized proteins, different types of proteins like enzymes. So this chemotherapy targets variety of steps in the cancer cell proliferation, or not only cancer cells, other cells as well, like bone marrow cells, GI tract epithelial cells, skin cells. That's why it is called non-specific, not specifically directed to cancer. Nowadays, targeted therapies and immunotherapies use is increasing day by day. Immunotherapy is increasing day by day because they have shown to be additive benefit, less side effects. That's why they are becoming popular. Okay. So this is in nutshell about cytotoxic chemotherapy, targeted therapy, and immunotherapy. And I hope it helps. If you have any questions or any concerns regarding this topic, you can comment it down and I will be happy to answer it. Thank you.